I love being part of people's growing families as well as their current families. Pretty much all the children that I've delivered in the past several years have always come back to see me as the pediatrician too. I'm Paulo Michelini. I am a family medicine obstetrician. I grew up in the Midwest mostly. I did my undergrad at Illinois Wesleyan University. I actually studied business, which is not typical for a physician. I also got an MBA degree at Loyola University in Chicago. And then when I finally did go into medicine, I went to University of Illinois, studied primarily in the Peoria campus, which is a great primary care campus, after which I stayed on to do my family medicine and community medicine residency there, after which I went to Memphis, Tennessee to work with a nonprofit foundation called the Camellia Foundation, where I got to learn a little bit more advanced skills in obstetrics, ultrasound, surgical obstetrics, as well as some gynecological surgery. The medical field was always something that I felt was a calling, as cliche as that might sound, but it took me a little while to get there, and eventually I did, and I'm certainly happy I did. I love taking care of people, and I love the primary care setting because it allows me to not only take care of single people, but whole families, whole communities. The way I practice medicine is really anything from birth to death, and anything in between. I'm very commonly see full families together in one visit to kind of keep everything as convenient and as easy as possible, especially for parents with lots of kids. I like to see them all in one visit, but also seeing everything from newborn babies, midlife, end-of-life care. All of that is very important to me. Obviously, I do obstetrics, and so the whole pre-pregnancy, pregnancy, delivery, postpartum is really important to me. I love doing it. I love being part of people's growing families as well as their current families. The journey, we always say that starts even before you get pregnant, and so getting to know you and helping you whether you've had difficulty getting pregnant or not, at least getting you prepared, whether that's through guidance as to how to healthy prepare for a pregnancy. It's not unusual for us to see women very frequently during the entirety of their pregnancy. Some women more than others, depending on what their preference is, depending on how complicated or uncomplicated the pregnancy might be, and so I'm open to being extremely flexible with that, and I always have with my patients. I've always had a pretty direct line of communication with patients as well, allowing them to call into the clinic and ask questions, even if it sounds stupid to them. Nothing is stupid, because pregnancy is a time of life that can be a little anxious. It can be a little difficult sometimes not knowing what's going on in there, and so I certainly respect that. Pretty much all the children that I've delivered in the past several years have always come back to see me as the pediatrician too, and so I love being able to see the family grow while seeing both the woman, the child, or children after that, and ultimately I end up seeing the father and the grandparents, and that's wonderful too.
Crossing rivers, health, your bridge to wellness.